afternoon. Hello, podcast viewers and listeners. I'm your host, Marilyn Santiago, and today we will continue with our latest topic on adult ADHD. Again, today we have Melissa Tamayo, our physician assistant and operations manager here at Harmony United Psychiatric Care. Welcome again, Melissa. How are you?
I'm doing well. Glad to be back.
Thank you so much. Okay. So, we talked about the strategies, we talked about sleep, we talked about the tools. Let's talk a little bit about resources. And I would love to focus on Harmony United Psychiatric Care because, Harmony has a full array of services and providers that are here to assist their clients. We're approaching adult ADHD. It's something that I don't want to say trending, but it's something that's being a lot more common than before.
Mhm.
So what type of assessment tools or what process could I follow? Let's say I'm your client, I'm a patient, I walk in, I tell you, these are my concerns. I just can't focus. I'm all over the place sometimes as well. I start not finish. I'm giving you all the characteristics of an adult ADHD that could be a diagnosis. So how
Mhm.
do we start? How does that process start? And then let's leave the resources, what Harmony, all those resources for last. But let's start
Mhm.
on how we get diagnosed.
Yeah, so the first thing, I mean, obviously you have an initial appointment. So whether you meet with one of the med management providers or one of the therapists, the whole point of that interview is to essentially collect information to try to figure out and hone in a little bit on what could be going on, right?
Mhm.
A lot of the times there are certain scales or questionnaires that are utilized to kind of rule in, rule out what could be going on. For example, if someone comes in and is complaining of focus concentration issues, of course, right, ADHD questionnaire would be warranted, but also anxiety and also MDD, right, major depressive disorder questionnaires would be warranted because we want to kind of figure out and hone in a little bit where these symptoms are coming from because sometimes they're similar and they get blurred. So definitely the clinical interview is important, and then the questionnaires that follow that. Now, based on what some of the answers are, what we're seeing in the questionnaire, then that kind of guides us a little bit as to what could be going on. And in this case, since we're talking about ADHD, if we have a strong suspicion of that's what's going on, the next step would be trying to figure out what is going on with ADHD, what's the severity of it? Is there ADHD, a kind of a confirmation aspect of it? And for that, we have certain testing that we do. Most familiar to it is called an NCT test or a neurocognitive neuropsychological testing. So in this, we get kind of a little bit more specific into the cognitive process, whether it be attention, memory, executive functioning, which are all areas that are involved with ADHD, but we can test each one particularly and see how much of a deficit there is, or if maybe there isn't any deficit, and get a better picture of what's going on with ADHD and also what type it is, because there's different types of ADHD.
Oh.
For adults, we tend to see a little bit more of the inattentive, but I'm sure we've heard of hyperactivity, or some people have a
Mhm.
combination of it. So those specific tests for ADHD can kind of give us a better picture of what's going on. And that also lets us know what to do as far as treatment from that point forward. Whether you meet, let's say, with a therapist or med management following that testing, we have a better idea of what we would need to intervene with to try to help, manage those symptoms a little bit better. Outside of that, if we have, for example, a little bit of a younger patient, adulthood, we're looking 18 and above, but if we have someone that's right at the cusp, let's say 16 to 18 years old, we have the option to consider information from family members, teachers as well, to kind of get a better picture outside of what we're just seeing in that clinical aspect in that one visit. And make sure we're getting kind of the full spectrum in regards to symptomology or what we're seeing outside of that. So there's a couple of things. Now, obviously, from that point forward, after the testing, after there's been confirmation of ADHD or adult ADHD in this case, then, like you mentioned, we'd go into kind of treatment options at Harmony and what would be, appropriate based on what we saw through the testing.
And what treatment options does Harmony provide or
Yeah.
is currently available to its clients?
So there's obviously med management. So on the medication management side, you're meeting with providers who prescribe medications. There's an array of medications available for ADHD. Primarily, they're looked at two options, which are stimulant and non-stimulant medications. And based on what we saw in some of that testing, the results on there, we can kind of, essentially narrow a little bit what would be a better modality for treatment. So there's medication management, obviously, and we talked a little bit about it before, there's a therapeutic side of it, right? So it's a behavioral aspect of it. So we use a lot of CBT, which is cognitive behavioral therapy, to try to treat, and help a little bit, hone in on some of those time management issues, how to better cope, with ADHD, how to reduce stress levels, for example, and how to address that in a favorable way to kind of benefit that patient manage their ADHD. And a lot of the times we consider med management and therapy, combination therapy, to be the best way to manage it, right? Of course, medication, hands down, does have a chemical approach to it and can kind of help with dopamine and some of these chemicals that we see affected in ADHD. However, that means nothing if we don't work on time management and how to balance our stress and our life, issues. So it really takes both to get kind of a good understanding of what's going on and try to address it as a whole, right?
So Harmony, they do the referrals within. So if I go to a psychiatrist or a psychiatric mental health nurse practitioner, that Harmony has great providers, all of them are. For the continuity of care of the ADHD, okay, so I'm doing your medication management piece, but now let's do the therapy piece to assist you and give you that support so you can focus, so you can work on time management. So the referral is internal and they go to a psychologist or a licensed mental health counselor. How does that work?
Yeah, so like let's say the patient was coming in for their first initial evaluation, and let's say it was with medication management. So we discussed, I think you have ADHD. We want to kind of pursue to get some formalization of this and move to do like a neurocognitive test. So we have clinical psychologists in-house that are able to administer that test. So we would refer to one of them to do it. You would schedule an appointment and do the testing. They would then not only, populate the report, but also offer an appointment separately to discuss, if you wanted to, the results one-on-one. And if you had any question in regards to certain parts of the test, then they would be able to kind of explain a little bit further. After that, you would be seeing med management, and then we would discuss, based on the report, medications to start, what to consider, if you were open to that, while also being able to see the therapist and continue working on some of those kind of behavioral aspects as well.
Okay, thank you for that. So and you probably already answered this, but I'm just gonna go ahead and ask, and it doesn't hurt to if you already answered, to repeat it and let us know, right? Does Harmony United Psychiatric Care provide cognitive behavioral therapy on other forms of psychotherapy, or other forms of behavioral therapy? So not just that CBT, what other forms of therapy, if you will, Harmony provides to its clients or to its patients?
Yeah, there's different components when we break down CBT or cognitive behavioral therapy. When we have a patient, for example, that is specific to ADHD, of course, we try to approach it to almost target a little bit what we would naturally see behavioral patterns with ADHD patients. However, we talked a little bit about before, mindfulness becomes a good component of it. So there's a mindful basis of cognitive therapy that could be utilized as well. And also what we call ACT, which is acceptance and commitment therapy. This becomes very important for multiple diagnoses, but it's hard, it's hard to, let's say after you've dealt with these symptoms, especially if we're getting a newly diagnosed as an adult, to accept that this is what's been going on this whole time, right? That this isn't just how I am or an issue I have, right? That it explains what's been going on. And although for some that could be viewed as like, oh, finally, now I can get the treatment. Others, sometimes get stuck and start reflecting on what if I would have found this out earlier, or what if, this was identified when I was in elementary school, what would my life be now? And that can open up a little bit of Pandora's box into the emotional world, right? Whether it be anxiety, depression, guilt, resentfulness in family. So that portion of it becomes important, especially for those that have a little bit of an issue processing the diagnoses once, let's say, it is formalized, and becomes an important part that needs to be addressed prior to moving forward to treating ADHD. So that definitely is a big component of it that oftentimes is left out. And we try, I think a lot of times it gets so focused to tactics and tips on ADHD, rather than the emotional connection that goes behind, being diagnosed with ADHD and realizing that this is what's been going on for so long.
So, here comes an adult person newly diagnosed with ADHD. It's a huge impact, like maybe any other catastrophic illness would be, right? Because that's part of the adult ADHD. That's part of how they cope, right? And that's all they know. So as an adult, the supportive family is very important, but then you have the family that doesn't understand ADHD. Does Harmony have resources where we can get, the patient, the diagnosed patient, and their families together and educate them on, supporting mechanisms or skills maybe, or even developing a supporting skill to their family? Because let me tell you, it could be a shocker that here you are over 50 or over 40 or even over 30, and you see yourself that you haven't accomplished everything that you wanted in life as of today, and then all of a sudden, boom, this bomb hits that you're diagnosed with adult ADHD. And like you said, instead of saying, oh, now I got a name to my problem, it's like, oh my goodness, this is a problem. And here, open the box of the Pandora box, right? And all these feelings are going to come out. I'm going to feel even more confused. The impulsivity is going to be triggered. Mood swings will be triggered, right? Because anything you say, oh, you're attacking me because I have ADHD. So the patient becomes very delicate emotionally. So how can we educate their families? Do we have therapists? And I'm sure, does Harmony have it? I know they do. Therapists that will work in conjunction with the family and provide like a family therapy, if you will, for that person that has ADHD?
We do, yeah. I mean, as much as we offer individual
Sorry.
therapy, therapists that do family couples therapy, that can kind of help. Even if, let's say, a patient is doing individual therapy, there are therapists that are willing to have family or a couple come in, on one or two occasions to kind of discuss or educate a little bit about what's going on or how they can be supportive. Because one of the things we see a lot in therapy is just the lack of understanding of how to support someone who's going through whatever it may be, whether it be ADHD, anxiety, crisis. They want to help, they don't know what to do, and sometimes what they end up doing ends up making things worse. And so, yeah, we have therapists that are willing to accommodate families and, marital counseling to try to help be supportive or teach the patients' families how to be supportive and create kind of a supportive environment at home in a personal basis.
Is telehealth, because Harmony offers telehealth appointments, right? So is telehealth, or will the telehealth appointments, if you will, provide the same effect as an in-person appointment for ADHD diagnosed patients?
Mhm. So it depends. I think there's up to the patient, but there's a little bit of a mixed aspect to it. Telehealth, very accessible, very helpful in that sense. Sometimes can be a little bit harder to find the privacy. Those that can, it's not a big barrier, a big limiting factor. Others, for the lack of privacy, prefer in person because they have a separate time. They're not at home. They don't have to filter what they're saying based on what's going on or who may be in the room or here, and also feel like it's a little bit more personable, easier to build a rapport when you're doing face-to-face sessions. So it depends on honestly the patients, but I've seen both. I've seen some that are much more comfortable with the video, the tele aspect of it, and others that prefer the in-person. I think they can both be effective. More importantly is, what does the patient feel more comfortable with, right? And trying to then move towards that option if there is a preferred option. Because at the end of the day, when it comes to therapy, it comes to the patient's involvement in that therapy session to try to see what they're getting out of it. And if there's any limiting factor or something that's holding them back from expressing what's going on and trying to work on it, then that may be an issue, right?
Right. So, we're getting to the end of our podcast today, and I just would like to mention, Harmony United Psychiatric Care has 13 locations currently, and they are expanding dramatically across the state, providing mental health services to its communities. And Harmony has an array of providers, from medication management, psychotherapy, right, and psychological testing, as you mentioned. And we've talked about it in previous podcasts, Melissa. Thank you. They also have psychiatrists in-house. They have psychologists. They have psychologists that focus on testing, psychiatric mental health nurse practitioners, physician assistant. You are a certified physician assistant and the operations manager for Harmony, but they also have the therapy side, which gives the patient a sense of being at ease, that they don't have to be going to a different office to see a counselor, because Harmony has it all, which is great. My last question to you is, what would you tell our patients, not only those that are adult diagnosed with adult ADHD, but all our patients in general, parents that are looking for mental health services, what would you tell them about Harmony, to just bring them over and look at our facilities and see our providers? What would you tell them if you had that chance to be out there? What would be those words that will bring me in?
Yeah, I think that the important part of it is what you mentioned, kind of continuity of care. So when it comes to treatment, any type of treatment, but specifically with ADHD, there's a lot of steps to it. And when you have to go here for step one and wait 3-4 weeks to go here for step two, and then come back to step one, and then possibly see someone else in another location, it becomes hard to keep that continuity of care because everything's kind of spread out and dependent on different variables, right? So something that's awesome and great about Harmony is everything to, you're able to deal with medication management, get testing, do therapy, go back to that med management provider, and they'll be able to see where you're at with the testing, what's been talked about in therapy. So it becomes a lot easier to promote and be able to provide continuity of care. And honestly, that's the best way to kind of keep the best outcomes. So in that essence, the fact that everything is handled in-house, that we're able to kind of communicate between the different areas, the different provider types, and be able to access information from each, it makes it so that we're able to supply the best possible, right, resource to the patient and provide the best care.
Wow, Melissa, I thank you so much for being part of this discussion. We started out from COVID, how adult ADHD has evolved and how it's more common today, resources available. Harmony is out there to help its patients in different areas of the state. I also want to thank the viewers and the listeners because they make us think about what other important topics are out there that we can share, right? So thank you, Melissa, for being with us on this final episode of Adult ADHD. For my listeners and viewers, please hit the subscribe button. Remember to share with your friends and families. These are important topics. The subscribe button will allow you to keep up to date with our topics and what we're doing out there at Harmony United Psychiatric Care, right? Give us thumbs up, like our videos, and if you have any questions or comments, we welcome these. So please write your comments below, and we will make sure that we will answer all your questions. Melissa, again, thank you very much. Thank everyone for your support, and we will catch you on our next Harmony episode. Have a good one.